If you're here and you are not sure if vacuum therapy is the right treatment for you when it comes to erectile dysfunction, I encourage you to continue to do your research, look through the site. You can always email us at education@timmmedical.com and we will do our very best to answer the questions you might have. There are no guarantees that any treatment for erectile dysfunction, and whether that's the oral medications that you're familiar with, the injections, the wave technology, and even vacuum therapy systems, no guarantee that every one of those will work for every patient. So it really is a decision that you have to make. The first thing I would encourage you to do is talk to your healthcare provider and make sure that you have clearance to try a vacuum therapy system. If you're looking at this and you're asking yourself, well, what are the benefits? How does this pay off for me potentially? The one thing I will say is that if you look through the data, you can see that there's ample evidence that a vacuum therapy system has a high level of success for a lot of patients. And I just want to go through some of the benefits of a vacuum therapy system for you, and then look at patients who are type 2 diabetic patients and also struggling with erectile dysfunction, and also for those patients who have had their prostate removed or are preparing for that sort of surgery at some point in the near future. What are the benefits of a vacuum therapy system? Patients respond as well to a vacuum erection device as they do to a PDE5 inhibitor or the oral medication. The vacuum therapy system produces an erection for 9 out of 10 men regardless of the cause of the erectile dysfunction. It's non-invasive and has an established 25+ year safety track record. So you can see that there are great benefits to a vacuum therapy system. Now let's say that you are a gentleman who has been diagnosed with type 2 diabetes and you're also struggling with erectile dysfunction. The vacuum therapy system may be a solution for you when it comes to that. According to the Massachusetts male aging study, a diabetic man was 3 times more likely to have ED than a non-diabetic. Studies have found that diabetics are less likely to respond to a PDE5 inhibitor. The overall success rate for men using the Osborne, Erecade, and pos-t-vac system is 90%. Now, if you are a patient who is preparing for or have recently gone through a radical prostatectomy, the vacuum therapy system may be a treatment for you, rehabilitation of tissue, and preparation and recovery from that surgery. Even mild trauma during surgery can cause temporary or permanent damage to the nerves and blood vessels that are required for an erection. Studies show that using a VED to produce artificial erections 1 month post-surgery provides improved erectile function and less penile atrophy. I know that we've hit you with a lot of information there, and if you have further questions, just email education@timmmedical.com. We want you to be successful, and the best probability of ensuring that happens is if you are educated going into this. You know what to expect, you know how to troubleshoot. Check out the other videos on the site here. We're teaching you how to use the device, how to get started, any issues that you might have, and just let us know how we can help.